So, for example, it's important to think about how AI can make a difference, for example, for patients and physicians. And the way that it's being integrated is honestly very seamlessly. There are a lot of people building solutions out there that exist for healthcare. So, for example, we have translation tools between physicians and doctors. This is something that a lot of people struggle with, especially in the region when most patients are Arabic speaking, for example, and then the physicians are English speaking. There is that gap, right? So AI can definitely be helpful there. But in general, there is a push for it across healthcare, and there is funding available for it.
Welcome, everyone, to the Bedsides and Boardroom podcast, where we speak about the intersection between business and medicine. And we've got Taleen Barghouti on as our guest today and our expert that we're going to be drawing on your knowledge. Welcome to the podcast. Thank you for joining.
Thank you. Thank you so much for having me. Looking forward to it.
We're definitely looking forward to having you on. As just a quick introduction, can you tell us about your career and what you've done so far?
Yeah, of course. So just as a background, I'm from Saudi Arabia. I grew up there, and I pursued my studies in the US in Boston. So I went to Northeastern and I studied industrial engineering. So far, no healthcare. However, I've always enjoyed healthcare because both my brothers pursued that field in my family, so I wanted to follow that trend. So in industrial engineering, a lot of people have the option to go within different fields. So, for example, people ended up going into banking or consulting. I always enjoyed the business aspect of industrial engineering, but I felt like healthcare was always calling me. And we had a co-op program there where we could apply anywhere. And I did my first co-op at Medtronic. And when I worked there, I worked with the surgical robotics team. And it was actually before it was launched, and it was during peak COVID, which was already a crazy time. So that's honestly what started my passion towards healthcare, my experience at Medtronic. And then since then, I've always wanted that mix of business and healthcare together, which is what I did at Medtronic. So after I graduated, I only looked into that field, and then I found healthcare consulting to be what I was looking for. So I worked at a company called Alira Health in Boston, and the first year that I was there, I was mostly focused on medical devices and med tech. And then the next year, I was focused on biotech. So very exciting work that I was doing in Boston, best healthcare city. And then I decided I wanted to bring all the exciting stuff that I've learned from the US and go back to the region where I was brought up, hence why I moved. And essentially, I moved to the UAE close enough to home. And I also pursued healthcare consulting here, but it was slightly different. We'll talk about this in more detail. But the work that I was focused on here was more related to hospitals improvements, regulatory, working with the DHA, DOH, for example, slightly different than my exposure in the US. And then I decided I wanted to explore something new, still within the healthcare route, but I wanted to try the AI space. So right now, I work at Pure Health as a product manager in their AI office, which is also a very exciting space to be in.
We've just done an episode on AI and healthcare, and we could have spoken for 3 hours because there's so much that's going on in that space, and we are going to touch on that now.
For sure.
But just for our listeners that are coming from more business background, can you just give us just an overview of what is the structure of the healthcare system in the US and what is the structure, let's say, in the Gulf countries and Saudi Arabia, but also
Yeah.
the UAE?
So as many of you know, the US system is extremely complicated. In the US, every state operates completely on its own. Same in the UAE. Every Emirates operates on its own. Dubai has its own laws. Abu Dhabi has its own laws. So in that sense, they're a bit similar. Saudi is a more centralized system for sure. All of Saudi has one Ministry of Health, and then it operates in a similar way. So just high level, I would say those are the main similarities and differences. But I would say also the funding for innovation is something that this region here is definitely more advanced on. When I worked in the US, a lot of our clients were companies that were building innovative solutions, but then when we used to go to payers and ask for reimbursement for those solutions, especially AI solutions, there was still some drawback and limited funding. So I would argue that in Saudi and in UAE, they're advocates for those tools. And in fact, they've changed their KPIs include innovation, and it's part of the growth, which I think is also one of the reasons that I'm very excited to be here is for that reason. The US is still amazing when it comes to the research and the faculty that they have. They've done a lot of work on um, the different types of spaces, the rare disease spaces. Even in general, their clinical trials are one of the most advanced in the entire world.
I think that is such a nice thought when it comes to how a healthcare system develops and its complexity. I think when we're sitting in the middle of a healthcare system, we can say, okay, this is this problem, this is that problem, we've got this kind of issue. But it's sometimes difficult to change those systems, from the start, whereas if we compare the complexity that you have in the US compared to the Gulf countries, because a lot of things are quite new, kind of taken all of the best parts of healthcare systems, especially the funding side, um, and made it into something that is the best. Is makes it ticks a lot of those boxes. It ticks a lot of accessibility, equality,
For sure,
affordability, those kind of things.
for
So
sure,
if we just go to the funding side, because healthcare doesn't work in a bubble outside of the economy. It um, needs to make money at some point. They needs to, well, I think healthcare doesn't need to make money, but it needs to treat people, and there's expenses to healthcare.
for sure.
So, how is the average person, me or you, someone else, accessing healthcare um, in the US? Who's funding it, and how is it accessed?
That's a very good question, and I would say that's actually one of the biggest issues that the US is facing is access to care. Even though they have some services like Medicaid and Medicare that are funded by the government, if I'm not working there or if my company is not supporting my insurance, it's actually completely unaffordable, and it does affect the quality of care at the same time, because when a patient goes in and they're anxious and they end up not going to seek the care that they need because they cannot afford it. So that ends up being the main issue, and it's really sad to see, because the reason honestly that I'm in the space, other than the fact that I was inspired by my brothers, is it this space is all about helping other people and serving patients. All of us have been patients at one point, and all you've wanted was the best care. So some of us are fortunate enough to have this, but many others don't have that opportunity. So yeah, in the US, I think the affordability aspect is definitely not there, and is something that they for sure need to look into. Meanwhile, here in the region, everyone is able to get the care that they want. Even if your employer, even if you don't want to seek the insurance that your employer would provide you, there are multiple affordable options. They even have options for um, like the Kareem drivers, the Talabat drivers. They have insurance that will protect them, so that they're not left out. So I do think that insurance in general is a whole topic on its own that might need a whole other discussion, because insurance is definitely a big topic here. But I do think that the quality of care mixed with research are two important factors that need to be piled together. This definitely needs to be looked into.
Yeah, I think I come from South Africa, and we've got a healthcare system there. It's quite divided around two main types of payers. So we have the private healthcare, which is very similar to the US, where it's paid for through insurers. And then we have public health care, which is paid for by the government. Most of the money goes into the private sector, and most of the people are treated in the public sector. But when we go to the hospital, we can first of all get care. So if you can't afford insurance, which the vast majority of South Africans unfortunately can't, you can go somewhere and you can get basically free healthcare. Um, so the quality of that care, I worked in the government sector for 5 years, so I understand the quality of the care is probably not the best in the world. But you can, if you have HIV, you can get antiretrovirals. If you in a car accident and you get a head injury, you can get treated in an ICU, and you can get surgery on your brain. Essentially, don't pay for it in the public sector.
Right.
Private sector is obviously a bit different. But one thing that I found from South Africa, and you touched on it here in the UAE, is that we paid a co-payment, or if I go to the doctor here in the UAE, I pay a co-payment. It's a small amount. In dollar terms, $12, $13 if I want to go to the doctor. Some of my medications are paid for if I need medications. And I don't see a bill afterwards.
Right.
There's no bill that comes at the end. In the South African system, you have a co-payment, and you might have similar thing where you pay up front. And I was fortunate I didn't get sick very often when I lived there. But if I went to ICU and I was really sick, a lot of those bills would get paid for. I think you do have to pay a bit more if it's in the private sector, but if you're in the public sector, you essentially don't pay.
Oh, it's really
So, I mean,
unfortunate.
that's a scary thought.
It is. And just imagine how many people just don't seek care at all, and they're just they avoid that, and it ends up deteriorate it ends up worsening their condition, just because the idea of paying for their bills gives them more anxiety, so they'd rather not. And honestly, at that point, understandable. Like if they don't have this the support that they need, then they won't be able to do it. Exactly.
I think that if we speak about, well, if we go into health, going back into the healthcare system, what is the actual healthcare system, and is how do people access healthcare? Um,
It's a very good question. This is a conversation that I've had a lot recently is we are talking a lot about AI and advancements, and we're already pushing everyone to do those. But for us to do that, we need to make sure that there is the proper governance and that people
Mm.
are ready. And I think that we haven't discussed this so far, but readiness is extremely important. And fundamentally, for example, we don't have a lot of data. We still need to establish that the data governance, we need to have a proper system set up so that we can use that and then leverage AI to enhance it. But I do think there's a little bit of a clash of pushing for AI, but then still we're not 100% ready as a population. So that's where I would say it can be improved.
So there's a regulatory issue.
Yeah.
Yeah. And I think, if we go touch back on the funding, um, I think that complexity is a major problem. And I think what is nice that I've seen in the Gulf is that, well, in the UAE, is that insurers, there's really 5 levels of insurance that you can get. And it covers you for different levels. This is when I tried to get my own insurance, because almost everyone is covered through the employer. So if you've
Right.
got a visa, you get an ID, you get insurance through your company, which I think that gives you a level of care that what means that everyone has access to care, which is a major part of healthcare. And then there's these kind of 5 levels that you can choose for your insurance, and that will give you different co-payment levels and different things will be covered. But it's a very simple system. Everyone is required that has employees to provide them with insurance. Then those employees can choose from 5 different options, or if it's provided to them by the employer. Mm. So I think we're going to do something that we don't normally do in the podcast, which is just get political. And we've got a closing tradition where we ask one question that the guest hasn't seen. So this is your question. So what do you think is the biggest threat to the US healthcare system? Is it the cost, inequality, or corporate influence?
Can you repeat that question again?
What is the biggest threat to the US healthcare system? Do you think it's the cost of healthcare? Do you think it's inequality? Or would you say that it's corporate influence?
Wow. Honestly, I like the answer. I would want to say inequality because honestly, the system there is inequality. Even when we look at clinical trials, a lot of them for so long have only been focused on male, white male, certain age, and it wasn't diverse, which defeats the whole purpose of a clinical trial because it's meant to be rolled out to the larger audience and to everyone. So that's a really big topic, inequality, which we actually didn't discuss. But I would still go back to, I think the answer to your question would be cost. And it is the biggest healthcare threat because not just cost of healthcare when it comes to funding and investment, but also cost on patients.
There's no perfect healthcare system in the world. Either you pay a little bit too much for it, or it's very difficult to access it. It's unequally distributed. There's a whole bunch of problems, and we could have another 10 episodes on how the South African healthcare system is letting some patients
I'd love to
down.
hear that. I'd love to learn that honestly. But yeah, it's really hard to compare both at a very detailed level because there's so much there's so many different ways that we can look at it. And but I do think that there was a few points that we covered, like access to care, quality of care, funding, innovation, and just in general the research that's being done. There's a lot of pros and cons, but I think there is a way that both of these regions can learn off of each other and work hand in hand.
Absolutely.
It would be great if they can overlap and support each other in that sense.
So
Thank
much.
you.
AI and this new technology that is seemingly taking over the world and changing the way that we do things. So, how would you say that AI is being integrated in the US and in the Gulf?
Yeah, that's a great question. AI has been a buzzword term that everyone's been talking about, and I didn't think that I'd be one of those people that would also talk about it in detail. Because for so long, you would hear about it, but you don't really understand what does AI really mean. And now that I'm in this space, I really understand how it's being used and what it means and the difference between generative and agents and how to build agents. I've learned all of that, which is great and happy to share that knowledge. But no, in general, I would say that so the type of work that I'm doing here for AI for the AI space is more to the entities that we have in Abu Dhabi. There is a lot of push for AI, and even within the organization, we're having AI KPIs. These entities are being pushed to incorporate AI elements into their workflows. It's important to think about how AI can make a difference, for example, for patients and physicians, and the way that it's being integrated is honestly very seamlessly. There are a lot of people building solutions out there that exist for healthcare. So, for example, we have translation tools between physicians and doctors. This is something that a lot of people struggle with, especially in the region when most patients are Arabic speaking, for example, and then the physicians are English speaking. There is that gap, right? So AI can definitely be helpful there. But in general, there is a push for it across healthcare, and there is funding available for it. So that's really good to see. In the US, I've also worked for a couple of AI initiatives for healthcare. One of them is breast cancer detection AI detection tool. So essentially, instead of calling out the true positives, it would call out the true negatives, which is a different approach than how most people would do it. But that was one of the AI tools that we were looking at. But again, I was surprised because we would go interview physicians and we would go speak to payers, and the payers immediately they say if this tool is aimed to um, replace radiologists, then we will not pay for it. So there's still a pushback on replacing humans, which I guess is a good thing at the same time. But they really emphasize that you need to be careful about how you position this tool, right? So if we're saying this is the breast cancer tool that is 100% reducing errors, and that means that certain radiologists would not be needed, then that's not what they're looking for. They're looking for a tool that enhances the quality of care, that helps the physicians get better results, but not completely replace them. But at the end of the day, the productivity and numbers need to line up. And if we're introducing AI tools that are extremely expensive, then that can unfortunately come with a cost. So,
I think that's an interesting take because I've always thought that AI will take over some of our duties as healthcare providers, but won't replace a human completely because there's lots of aspects of healthcare that are not related to just fixing the problems in your body. It's not just related to reversing illness or healing your trauma or whatever the case is. It's actually about, speaking to someone, connecting to another human, going to someone, having eye contact, seeing that person.
100%.
So I think AI is going to replace some aspects of what we do, but I don't think it's going to replace healthcare providers.
Definitely
Um,
not. Definitely not.
what are
I
the other
agree.
projects that you've worked on, um, or
Yeah,
that you've heard about that that have AI integrated into them?
I just wanted to comment on one thing that you said, and I definitely agree with that. Yani, as much as we are pushing for AI and it is a very cool space to be in, and I'm honestly really excited to be a part of this. However, I do think that that human element is extremely important, even for me as a patient. Um, I need a physical physician in front of me to tell me you need that empathy component, right?
Mm,
Even if ChatGPT sometimes is very close to that, the physician has an element. It's really tough, and that's something that they've expressed as concerns to me as well related to AI tools. They're saying when we go and tell a patient that they have cancer, which is probably the most difficult thing a physician has to do. Just imagine an AI tool having to do that, right? It takes away the human element. It takes away the human connection between the patient and the physician. So I agree with you 100%. Even though there are quotas for FTE reduction all around, and people are always scared that they're going to lose their jobs, and that's definitely a valid concern. I do think that the healthcare on its own is a very human place, and I personally hope that that part stays. We can't guarantee what can happen. We can't guarantee what AI can do. Maybe it will replace all of us, and maybe that's not a bad thing entirely. But we just need to be mindful of the human element and keep that in mind when we're pushing all these AI initiatives, and we're very excited about the future. I'd just like to add that element of keeping and being in the present and speaking with the physicians and having that human element. So
no, I agree with you. I couldn't imagine a healthcare system without that because of the nature of humans. Um, as much as in the last how many years, even since I was younger, with social media, more people are living digital lives. True human connection is not found digitally. And I don't think that healthcare is going to be moved into a space where we're just correcting problems. I think there's a lot more to it than that.
exactly.
Absolutely. Taleen, thank you so much for coming on the podcast. It was a great discussion. It's
Thank
great
you for having
to
me.
hear your views. Thank you.